All right, guys, we are live. So welcome, welcome CCA families and audience. We are so excited to have all of you joining us tonight for our orthognathic surgery, which is a fancy, hard to say word for jaw surgery webinar. We are super grateful that all of our panelists are here. This has been a highly requested topic. We know that many of you out there tonight are watching live, and some of you are going to catch the recording because you have an upcoming surgery. So just stay tuned for some great information, advice, and encouragement for that next milestone surgery that you will be having. I definitely want to introduce our panel, but before I do, I just want to remind everyone that this is a patient and parent panel. So these are definitely the views of our parents and patients, and they will offer you the best and most true and honest advice they can. But we certainly want you to realize that your situation is always unique, and your doctor and your healthcare provider and your team will be the ones to go to for specific workshopping of your case. And with that said, I'll read our official disclaimer, and that says this session is for informational and educational purposes only. It is led by volunteers and is not intended to diagnose or treat any illness or condition. Everyone on the call will offer their own experience, but no one can offer specific or individualized medical advice. We suggest you contact your medical doctor or medical team for those informations. And the views, thoughts, opinions expressed in this panel belong solely to the speakers and not necessarily to the Children's Craniofacial Association, the speaker's schools, employers, organizations, hospitals, committees, or other groups they are with which so involved. And my name is 𝐂𝐿𝐿𝐿 𝐂𝐿𝐿𝐿, and I'm the Executive Director of Children's Craniofacial Association, and I'll be facilitating tonight. I also have with me on the call two of our other staff members, Annie Reeves and Kara Jackman. So if you're watching live on Facebook, you can put your questions in the comment on this Facebook, and Annie and Kara are going to get those to our panelists. So don't be shy and definitely drop in your thoughts in those comments. We will be here to take those from you. So now I will introduce our wonderful panel. And first up, we have Chelsea. Chelsea Bulis currently resides in Chester, Virginia, and is a classically trained singer, music educator, and arts administrator. When she's not working, she encourages others to step into that spotlight by embracing their own uniqueness. Chelsea was born with Goldenhar syndrome and underwent her jaw reconstruction in 2002. The love of her life is her 20-pound cat, CJ, aka Squeaker. Thank you, Chelsea, for being here. 𝐷𝐷 Dankelson is our next panelist, and she is a CCA mom, and online, she and her son are known as Pete's Diary. Her son, Peter, is 20 years old and also has Goldenhar syndrome. They're part of a family of 4 plus 2 dogs. Abby is a white mini Labradoodle, and Dexter is a black Yorkie Poo. Peter's younger brother, Jacob, is 16. The Dankelsons live in north of Chicago and have been attending CCA retreats for 15 years. Peter had a jaw distraction when he was 3 years old and jaw reconstruction with a TMJ implant and Lefort when he was 16. He needed a trach for his first 4 years and had an open trach stoma for 19 years. Thank you, 𝐷𝐷. Next up, we have Nicole. Nicole Hilton is 29 and currently resides in Salt Lake City, but is hoping to move soon. That's a cliffhanger. Where? She lives with her boyfriend, her 2 rescue cats, and lots of plants. She is a researcher and consultant for families and special needs children and adults, and will be launching a mental health resource for craniofacial families and individuals soon. She had somewhere around 30 surgeries, including an underbite alignment when she was about 18. Thank you, Nicole. Then we have Crystal. Welcome, Crystal. Crystal Curry lives in Los Angeles, California, and was a full-time makeup artist in the film industry. She now serves as a public advocate on social media, is a certified speaker with CCA, and a full-time mother to her 3-year-old son, PJ, born with Treacher-Collins syndrome. PJ had neonatal jaw distraction at 6 weeks old, which enabled him to come home from the NICU 4 weeks later without a tracheostomy. Thanks to Dr. Stacy Francis, head of craniofacial surgery at Kaiser Sunset in Los Angeles. So welcome, Crystal.
Thank you.
Last but not least, we have Russell. Russell Newman is the father of two boys, Nathaniel and Jacob. Nathaniel, who is 17, has Treacher-Collins syndrome and was a tracheotomy dependent until he was 14. Nathaniel has undergone 3 mandibular distractions and in 2016 became one of the first TCS kids to undergo and benefit from the groundbreaking counterclockwise craniofacial distraction osteogenesis, also known as C3DO, performed by Dr. Richard Hopper at Seattle Children's Hospital. His other son, Jacob, is 15 and an avid lacrosse player. Russell, his wife Magda, and their boys and 4 dogs currently live in Seattle, Washington. Russell is an attorney by education, but has worked for the past 20 years in commercial insurance. A former CCA board member, Russell has been a tireless advocate for children and families affected by facial differences. So thank you, Russell, for being here.
Thanks for having me.
Absolutely. So we will get started. But again, I just want to mention to our audience who's coming on, you can see just from these introductions, there is a wide variety of surgeries represented here. So we want to address as many questions as possible in the next hour to 75 minutes, whatever our lovely panel will give us. So I'm going to start by handing this over to you guys, and we'll just go in the introduction order and have you say just a little bit about yourself. And if you want to expand on your surgery at all, now would be a perfect time to do it. So Chelsea, would you like to go first?
Sure thing. Hello, everybody. It's such a pleasure to be here and in such good company. Again, my name is Chelsea Bulis, and I was born with Golden Haar syndrome, and that has left me, in this particular case, what we're here to discuss today, I was a little deficient on this side, on the right side. My lower right mandible was stunted, so I had my jaw reconstruction in 2002. And it was a choice that we made to have it later on in life. And it was probably a good thing for us because there was concern about growth plate issues and things of that nature. So our medical team chose to hold off on that procedure and have it done in my teens. And yes, I had it in 2002. And it was a whirlwind. It was a hard choice. It was a choice that had a lot of anxiety surrounding it. But after looking back on it, and we were talking about the questions a little bit earlier, and I will say this, it's given me pause to really think about it because it's almost 20 years ago for me. And it's given me time to reflect. And I will say this, if I could go back and do it again, definitely would do it again.
Awesome. Thank you for that encouragement. Up next, we have Dee Dee.
I don't even know where to start. So Peter's 20. When he was born, he needed a trach when he was like 4 days old, and he was also a preemie. There was so many things going on, and at that time, neonatal jaw distraction was sort of like just being, they were just starting to do it. And he was born at U of M, and they tend to be more on the conservative side, and they weren't ready to jump on that bandwagon right away or anything. And Peter had so many issues with his neck and back, and just all these other high blood pressure, and just all these things going on that the trach was just the safest thing to do for him to secure his airway. And then we, from there worked until he was 4. Trying to figure out the cleft palate repair, the jaw distraction, and with Golden Haar, and I don't know if Chelsea, you have some experience with this, with Golden Haar, he was missing, you can't distract bone that's not there. And so in Peter's case, he didn't have bone to distract on the left side. So he had to have a rib grafted before that. And we actually went out of state. We had like 4 different opinions from 4 different doctors. And I guess I'm glad we went with who we went with, because I felt like he had the most experience, and Peter was able to avoid having his jaw wired shut as part of that process, because he also had severe reflux at the time. So it terrified me. He did have his jaw wired shut later when he was 16 and had the implant surgery, but so there's a lot of random stuff there, but you have to really kind of go, you have to take in all the information and go with what feels right to you with your spouse or your partner, whoever's helping you make the decision. Because when they're younger, when he was 2-3 years old, parents, guardians, you have to make all the decisions for them. Whereas when he had the surgery later in life, it was really, he was making the decision. And we had multiple opinions again for that as well. He had different options to do another jaw distraction. The TMJ implant was, I felt like, a newer thing at the time. So, you know, he led that more than us. And it was just, I felt my role to kind of guide him and get the answers he needed and, you know, give him our opinion, but ultimately he had to be the one to make the decision for himself.
No, that's perfect. Thank you, Dee Dee. You touched on like a lot of things we're going to get into. So perfect. You kind of gave us that roadmap of where we're going, but I think that's a perfect setup to a lot of the questions we have about choosing when your kids get to be involved, et cetera. So absolutely, we'll dive into that more. Thank you. Nicole, we'll have you up next.
Okay, I have Pfeiffer syndrome, and my main jaw surgery was around 18. It was to correct a pretty severe underbite, and it was done by a team in Sacramento. And it was a pretty, I don't know if uncomplicated is appropriate to use describing it, but it was a pretty straightforward procedure. And there were follow-up procedures to align the rest of my face in accordance with the new bite, but that was the main jaw surgery that I had at that time.
Thank you. I think that is an encouraging word for all of the listeners out there. Uncomplicated is what we want to hear.
Not always the case, but definitely possible.
Awesome. Thank you. Thank you. And we will have Crystal next, please.
Hello, I'm Crystal Corey Reyna-Farhe, and we live in Los Angeles, and PJ is my son, the little one, he's 3. He's my only child. He is my one and only. Don't plan to have any more. So he has Treacher-Collins syndrome, and he had the jaw distraction while we were still in the NICU. He was 6 weeks old. They chose to keep him in the NICU until he was eligible for the jaw distraction at 6 weeks old. And upon having the CT scan, they found that he did have enough bone to work with. So they went ahead with the jaw distraction, and he came home 4 weeks later without the need of a trach. So that's pretty much our story. We are headed for another jaw distraction. We're definitely headed for the red in the future. We may need one more jaw distraction between now and then. That just depends on the sleep study and how that goes. So we'll see what happens. But he does use oxygen at night. He's supposed to anyway. It's really difficult to get a 3-year-old to wear a cannula. So I've actually just rigged a device. I gave up on the cannula, and I rigged a device so that it's like funneling the air straight towards his face. And then I turn up the oxygen really high. So it's kind of like a blow by. And I just shoot it directly at his face when he's asleep. So that's how we're managing it right now. And, you know, when it gets to be a problem, we'll be headed for another jaw distraction.
Awesome. Thank you for that. That is always awesome to hear parent engineered solutions. So thank you. Wonderful. All right. And Russell, you are up now.
Thank you so much. And much like Dee Dee and Pete's story, you know, Nathaniel's was sort of the kitchen sink of Treacher-Collins syndrome, right? Like, as we all know, TCS runs a spectrum and can have varying effects. Nathaniel was born not only with a pretty deficient mandible, but no nasal passageways, no cheekbones, you know, like I said, complete 𝐂𝐂𝐀 in both sides, bilateral, no ears, no lower eyelids. So there was a lot to go through. Miraculously, he was breathing on his own for about the first 20 days of his life. But unfortunately, about day 20 in the NICU, they had to trach him. You know, he had to be trached, and we would live with that without realizing it for the next 14 years. Even with 3 mandibular distractions, you know, never got to a place where he could be decannulated, which for those who are learning as we go, decannulated is the phrase they use for getting the trach out. You know, we like to say ding dong, the trach is dead, but they say, you know, decannulation. But the combination of 𝐂𝐂𝐀, mid-face, rotated back, we came to the conclusion after 3 that mandibular distractions just were not going to get him to a place to get his trach out. It was about that time that The team at NYU, New York University Hospital, was going through some major changes and retirements. Dr. McCarthy, who's sort of the godfather of all this stuff that we've all been blessed with, was retiring. And I asked him, where would you take Nathaniel if he was your grandson? And he said Seattle Children's and Richard Hopper. So that's when we made the transition. And Dr. Hopper was still figuring out what is an homage to Star Wars with 3CDO, a very purposeful one, right? And so we embarked on what ended up being a 3-year journey, sort of hitting the pause button on future surgeries. And as Dr. Hopper developed this, combo procedure, which is a bit of a distraction, a bit of a mid-face, and then throw in a full rotation, we chose to embark on that. It was not without complications and did require, like Dee Dee talked about, jaw being wired shut, G-tube being reinserted. It was a 1.5 to 2 year process that my wife describes as barbaric. Dr. Hopper describes as extreme. But to Nicole's point, given an opportunity to do it all over again, Nathaniel would say yes, and has said yes, that he would do it all over again. And look, he's only done this procedure 15 times now, Dr. Hopper. So it's still what I would call, pioneering type stuff. But he has shown to have an 85% success rate in getting the most complicated airway kids decannulated. So that was our experience. There's so much more to that, but I don't want to monopolize the call. But I am happy to say, much like Peter, Nathaniel and Peter are both people who followed very different paths, but are not surviving anymore. They're absolutely thriving and living their best lives. So the road is bumpy, but the outcomes can be amazing. And I think Peter and Nathaniel are phenomenal examples of the bumps are worth it.
100%. I would agree with that. And thank you for bringing that up, Russell. And another point to Russell's, we do have some papers we can share out about this procedure. So we will make those available as well to anyone who wants those. And somehow we'll link those in the follow-up to this video, because it's really interesting to learn about that procedure. Let's stay on this topic kind of choosing teams. I like how, Russell, you referred to asking the team you were with when it was time to transition. And so Dee Dee, I just want to pop back over to you. And can you explain a little bit about your choice of how you chose the team to treat Peter?
Let's see. Okay, so when he was younger, we ended up getting opinions at different children's hospitals, and we were at Children's Hospital of Michigan in Detroit and U of M both. We had those opinions, and third and fourth opinions. The actual person that ended up doing Peter's rib graft and jaw distraction was in St. Louis. Dr. Marsh, who is retired now, Jeffrey Marsh, he was at St. Louis Children's, and the surgeon in Detroit actually was a fellow under him. And we were able to we just felt more comfortable with Dr. Marsh because he had a new technique at the time to immobilize the rib graft so his jaw wouldn't have to be wired shut. Otherwise, everyone else was going to wire his jaw shut. And that just terrified me. He had the trach and the feeding tube and all this other stuff going on too. And he was, throwing up multiple times a day. And I thought, there's no way this. So anyways, but we had a lot of follow-up in Michigan when we got back. So, and then Dr. Marsh also put the distraction device in when Peter had that, and we ended up staying at Children's because Peter ended up with an infection from the distraction appliance. Yes, that was I will say he had 35 surgeries or 36, and the jaw distraction that he had when he was 3, and then the one he had when he was 16 are the two worst, two of the 3 worst surgeries, I would say, that were the hardest that he's had. The last one he had was airway reconstruction, because even after all the jaw surgeries, he still had an open tracheostoma that we couldn't get closed. They weren't, his upper airway had been a lot enlarged surgically enough with the jaw surgeries, They'd done everything they could. He ultimately needs the CPAP at night to sleep now. And he then, once again, it was his decision because he was old enough, elected to have the airway reconstruction, the laryngotracheal reconstruction. But when we moved, when he was 16, he was 15, because like Russell, like you said, it was multiple years of planning, right? So what existed, we moved out of state from Michigan to Illinois. So we kind of by default had to find a new team. And so I started to research, and we started with orthodontics, because the orthodontist in Michigan referred us to, we got very, very lucky, and had a really good private orthodontist in Michigan who referred us to a private orthodontist in Illinois that was close to where we were moving. His dad wrote the book that Northwestern uses at their dental school. I mean, like he was phenomenal. And so he kind of helped me get started down that path. But we ended up, what existed when Peter was born and needed the jaw surgeries at, 15 to 20 years later is totally different. Like this TMJ implant that he had done, I hadn't even heard of it. So, we were able to do, his surgeon in Detroit referred us, kept saying, you have to go see John Polly. You have to go see John Polly. I'm like, well, I go online. I'm like, well, he just moved from Illinois, from Chicago back to Michigan. You want me to go back to Michigan? She's like, he's the guy you need to go to for this TMJ implant. You need to consult with him. So I did, loved him, great communicator. That was the number one thing for all Peter's surgeries. The surgeons we went with were great communicators with us. We were equal part of the team. And the orthodontist and Dr. Polly, it was Graber Orthodontics that we used. They all communicated so well, and it was just such a comfort level to know that they were talking. So, because this surgery, I'm sure like Nathaniel's and others, they're so complicated now. The good thing is they can do the surgery virtually beforehand, because all these kids have such unique anatomy that Peter's surgery was almost canceled like a month or two before, because the surgeon was designing it with the implant, and he's like, he calls one day, he's like, by the way, I'm going to have to take a chunk of skull bone to put it on this side because he doesn't have, blah, blah, blah. So that's going to involve a neurosurgeon. Okay. So he wouldn't have known that in advance without the technology that we have now. So to me, it's a lot safer, but it's also, it's a different level of planning, intense. It's like he literally had like a football coach's playbook, play by play, because these surgeries are so long too. They're like 8 hours, 10 hours, more than that even. And they're so involved, but it's incredible what they do now with technology. I mean, we saw 3D CAT scan, like bone models. Unbelievable. I don't know if I answered the question. I rambled.
No.
Too much history.
No, that was great. And I appreciate something you brought up too, and I'll just mention this and move on. If you are seeking a second opinion, please do reach out to CCA. If there's a financial barrier to that. We also fund medical travel. That's one of the main things we do. So know that you can reach out if you are looking for a team and you don't feel right with your team. That's a resource available to you. So I just wanted to throw that out there. Quickly,
I would say my last thing is always, always, always get a second or third opinion.
Yes.
Yeah. And they will be different.
And I hope you don't mind me chiming in, Erica. If you ever have a doctor tell you, oh no, you don't need a second opinion, I'm the guy, or I'm the guy. I had a doctor in Charlotte, North Carolina, who had never once operated on a kid with Treacher Collins, and said, oh, why does he still have a trach? I could have that out in a matter of days. Pick your child up and run. And Erica, on the team selection thing, it's just about asking questions and writing things down. And like you said, if you got to go out of state and can't afford it, call Erica, but one of the best things about the team in Seattle is they never once said, this is the answer. They just said, here's an option, you choose. And look, Dee Dee, you've made this point a couple of times, look, once Nathaniel hit a maturity level, probably well before an unaffected kid would because of the lives they lead. But like at age 13 and 14, we were entrusting Nathaniel with decisions that you wouldn't trust. Like I wouldn't let Jacob do that because he didn't know, but, at every step of the way, it was Nathaniel, when you were sitting with Dr. X, how did he make you feel? Did he make you feel comforted? Were you scared of him? Did you understand how he explained things to you? And we always let Nathaniel know that he had veto power. If he at any point said not happening, it was over. And and I know Dee Dee, you probably recognized, and Crystal, you will as well, and Chelsea and Nicole as adults now, there'll be a moment where you just know your kid's ready to have input. You'll know. Crystal, PJ will get there a lot faster than you think, just given who he is and what he's enduring. But that was also really key, is including Nathaniel in the process. And when he was like, I really like this Hopper dude, that was worth as much as his medical expertise.
Absolutely. Thank you. No, that is perfect. I really appreciate that answer. And I want to pop over to Crystal for a minute. You set her up nice there, Russell. Crystal, correct me if I'm wrong, but I think PJ's diagnosis might have been a surprise. And so you were kind of forced into a situation in a team. And did you stick with that team? Kind of walk us through your selection.
I did stick with that team. We had private insurance with Kaiser at that time. And as soon as he came out, of course, it was a surprise. And I, evaluated what was happening very quickly and decided to get him his own platinum plan with Kaiser, because I don't know how you guys do it. I couldn't have done it. I couldn't function with going doctor to doctor and door to door. And I just wanted everything under one roof. And we were transferred to Kaiser Sunset, which is that's like the Kaiser head honcho. That's the Children's Hospital of Kaiser's. And they're right across the street from CHLA. And that's where their surgeons trained at, was CHLA. And then they move across to Kaiser Sunset. So we were really comfortable in that hospital. And honestly, the surgeon came in and met with me, and I immediately clicked with her. And I liked her so much. She's just this positive, happy person, and she's so knowledgeable. And when she explains things, she's so excited about it. And you see this passion. And I was just like, wow, she makes me feel really good. And then I was like, I told her, I'm like, it's kind of also weird that you're really this passionate about cutting babies, right? We joked about that. So she made me comfortable. And then upon doing research, because people said, look into her, look into this, look into that. I think Judy Miller-Moschner, she was one of the first people that responded to me when I was reaching out on social media for anybody to help me. And she looked her up and she said, that's the head of craniofacial at Kaiser. I think you're good, So I was like, great. I knew I had a good feeling about her. And we're with her to this day. And like I said, I know not everybody can, now my husband, we don't have to afford Kaiser anymore. Now my husband switched jobs to get us medical benefits with Kaiser. So he works 80 hours a week to do that for us. And I'm forever grateful and blessed that he does that. And he's such a provider for us for medical benefits. But it's just really nice to go into Kaiser. And Thursday, we have our craniofacial clinic, and head and neck, the head of head and neck surgery will be there. The head of craniofacial surgery will be there. They all sit down in one room and meet with us. And, the right hand is never not talking to the left hand. Everybody's always communicating well. And I just like having everything under one roof. So that made it really easy. It didn't make it easy for me to deal with, but it made it easier to deal with. So that was our route.
Yeah, absolutely. Thank you so much for that. Mm-hmm. And I think that is also a good point. I'll just plug this as well. CCA really believes in team care. If you can go to a team, we prefer the ACPA teams because they are just like Crystal said, they are talking together. it may be a little overwhelming and intimidating the first time you're in a room and every provider comes in there to talk about you or your child, but it is we believe a better method of care to seek that out. It's not the only way, but it is certainly the prevailing way that we have seen be really successful. I do have a question from the audience that I'd kind of like to get Chelsea and then Nicole to pop in on this, because I think you guys might be a little bit older and have experience with some of this. So have you had any TMJ or jaw popping discomfort, and did your jaw surgery alleviate that? Chelsea, did you have anything to add on that?
Unmute. Well, yes. So I did have some TMJ issues going before the surgery, but I am as you mentioned in the bio, I'm a classical singer. So I'm very attuned to anything going on here facially. So TMJ is always a big sore spot for all of us, no pun intended. So those are things that we watch out for. But yes, I did have some issues prior to that. I did see a lull in them, but I do still have some popping issues. But as I like to say with any procedures that are of this nature, and especially as you transition into adulthood living with a craniofacial difference, we like to be in the maintenance phase. So for instance, even though I had my procedure back in 2002, I have had a revision to remove a screw. I have, things that come up sporadically, popping, soreness, things of that nature, specifically on the affected side. And those are just things I think that come with the territory. And you just assess them as they come along, and like I said, I had that revision done. There is something right now that we are watching and waiting with bated breath to make sure that we don't need to do any corrective procedures on. I can get to that a little bit later, but yes, to answer that question shortly, had some issues with it previously. It cleared it up a little bit, and I do still have some residual TMJ issues and some popping, but I don't think it's associated with the procedure itself. I think it's more stress, more so than anything else.
Okay, well, that's another webinar, stress management. And Nicole, what about you? Has that been part of your experience?
A very similar experience to Chelsea's. I've definitely had some jaw popping. I didn't have any issues before my jaw surgery to align my underbite, but definitely for years after, it was pretty significant. It's been less of a problem in recent years, but yeah, I mean, just like Chelsea was saying, just kind of addressing it as it comes up. Jaw massage. Some chiropractors specialize in cranial work. That's been really helpful more recently, and something that I want to continue doing. But it hasn't been a huge problem. I have found that most of the time, those types of issues come up right after surgery and will kind of fade away as the years pass, as the muscles kind of heal.
Awesome. Thank you for that. And we do have another question. And just from hearing you guys talk, I don't think this is the case, but I want to open it up just in case it is. Has anyone had experience with the overcorrection? Did your surgeon intentionally overcorrect to allow for growth? Or okay, Crystal, yeah, go ahead.
About that. Yes, our surgeon did overcorrect just to give him as much time as possible before he would need another distraction. So let's see, we grew over an inch of new bone, and I think we distracted twice a day for about 17 days. So his lower jaw was, out like this. And since then,
we call it the Jay Leno jaw.
Yes, and he's growing into it. Now it looks normal. It looks fine now. So I think she did a good job with the overcorrection.
That's Erica, part of the reason they do that too is, and you can see in the papers that Dr. Hopper wrote, it's very technical, but they plan for a recession percentage. So if they got PJ 17 millimeters of mandibular growth, they know that when the muscles strengthen and everything comes in, there's just a natural tendency for the body to scrunch it back up. So there's not only the growth piece where they want to give them as long as they can before the next one, if at all. There's also just, they know in the 90, 120 days post-operatively that the body's going to tighten up and they're going to lose some of the gains that they planned for. So one of the things that amazed me about these surgeries, and I'm sure everyone on this call is how technical it is. Like the math, like I always used, you always hear the joke, when am I ever going to use this math? Like, yes, these are craniofacial plastic surgeons and neonatal ear, nose, and throat surgeons. The amount of math they do and the precision behind how many millimeters of turn they're going to get and what depth of bone they're going to add. None of this is by accident. To Didi and Crystal's points, with 3D technology today and the molding they can do and everything, one of the reasons Dr. Hopper can do the C3DO today is because he can get it done in 17 hours. The technology 8 years ago, it would have taken 2 days. But because they now have everything pre-molded, pre-practiced, everything that they can do in advance as far as custom designing the devices, how much overgrowth they need. The biggest barrier to this procedure prior to, say, 3 years ago, it was physically impossible to get everything done in a manageable amount of time where a child could survive the anesthesiology of it. And, even with that, Nathaniel's first procedure with Dr. Hopper was 17 and a half hours. So anyway, yes, they overcorrect. We're all long-winded because we're very passionate about this stuff. But yeah, they're going to overcorrect and they're going to do it on purpose for both reasons. One, give your kid time. And two, they know they're going to lose some of what they gain just because of the way the body heals.
That is wonderful. You're more than welcome to be long-winded. These are the answers that people are relying on. So thank you. And that was an excellent explanation. One more, I'm kind of sorry to the audience. I'm kind of pulling out things from your questions, but does anyone deal with the smaller nose canals? Is that something that you have seen and do you want to talk about it? So just jump in. I'll look for your hands. I think Crystal, I saw your hand, and then Russell will get you next.
Yeah, PJ does have one side of his nostril that is completely obstructed. So only one side can take an NG tube, only one side he can breathe from, etc. So that's another airway obstruction.
Does it affect his smell? Has he complained about that?
No, okay. I don't even know if he does smell any. I mean, he pretends to smell the flowers that I bring home, but I don't know if he can or not.
He loves his mama, so he's making you happy. So, Erica, like anything else, particularly with Treacher Collins, and I'm speaking for Crystal and I, because we're the TCS parents, one of the most common features of our TCS kids is some amount of choanal atresia or smaller nasal passageways. You could have PJ's scenario where it's one nostril's completely obstructed, but the other's wide open. Or you can have what Nathaniel had, where they're both completely obstructed by rock hard bone. Or you could have a kid that has zero or something in the middle where it's like cartilage and messy and they just go in once and they clean it out and it's gone. Nathaniel needed choanal atresia repair 7 times, to get that nasal airway to remain open. He says he can't smell at all, but we catch him like, oh, who farted? So, he's a boy, right? Like, so, there are times when he's like, you're full of, you can smell, but he's clearly deficient in his ability to smell. And I did see in the question, like, how do they determine that? Look, again, it goes back to Erica's point about a team approach. If all you're seeing is a craniofacial surgeon, you're going to miss that. And if you're at a team environment, super easy. They do a nasal endoscopy. It's kind of cool. They stick a camera up there. The kid's most of them can tolerate it while they're awake. Nathaniel sort of takes it as a badge of honor that he could take the camera through his nose all the way down to his vocal cords without any anesthesia. I would vomit, but so one, they should be doing a nasal endoscopy on all of our kids, regardless of which condition. And then again, it's just so variable. Like, you know, some kids, it's going to be a process. Some it's going to be a one and done. And so again, that's a long-winded way of saying, yes, our TCS kids all have airway issues, but they're so variable. And the only way to know is to have an ENT go in with a camera.
Mhm.
Awesome. Thank you. Anybody else on the panel want to jump in there? Okay. Not seeing any hands, so I will definitely move on then. This is a one back to our more general questions, but I think it's really important to address. So is there anything that you specifically recommend product or supply wise? Because we get this a lot for when your child is coming home from this type of surgery. And Chelsea, I saw your hand go up, so I'm going to jump to you.
Okay, this is not necessarily medical, but when I had my procedure, I was wired shut for about 3 months and had complications. But day one, after I was discharged from the hospital, we made sure to have a blender in the house. Before that, we never had one. So having a blender, and then another one, we had other medical necessities that, you know, the hospital recommended, and yes, you go through those motions. But another one that is actually something that's been integrated into my everyday oral hygiene is a water pick. Being able to, yeah, I see thumbs up, a water pick, because obviously after a major surgery like a jaw reconstruction or distraction, you're going to have major swelling. You can barely open your mouth. And the biggest thing that your medical team is worried about is making sure that you avoid an infection as much as possible. And so you cannot clean as you normally would. So those are the two things, a blender and a water pick, because it just made cleaning a little bit better. And so it made my checkups over those 3 months and after a little bit better. I wasn't raked over the coals. It was definitely beneficial. So those are like the two medical outside of what they would send us home with. But yeah, those two things.
Perfect. And Russell has dropped in our chat here for any GTube kids, Real Food Blends. That is a company, and they're very supportive of CCA. They make some amazing high quality food products. So definitely check them out, Real Food Blends. Anybody else have a comfort measure or product that they want to share?
Honestly, a pet. I know that sounds crazy. There's science around it. It's just proven. They heal faster, swelling's reduced faster, blood pressure comes down faster. Something cuddly, it just helps. I swear, it's bizarre, but when Nathaniel gets home to his dogs, it literally changes everything when they have that.
Yeah. No, I totally agree with that. It's they're unconditional love, and they make you laugh too. So for the moms, I'll share a funny story to lighten it up a bit. When Peter was wired shut, and thankfully, I don't know how you did. Did you say 3 months, Chelsea? Oh Lord. Peter did 2 weeks. And he had a feeding tube, so we were able to put, it was much easier for him in terms of, staying hydrated and nutrition. But he ended up with a upper respiratory infection after we came home, right away after we came home, because of course you have all that drainage from the surgery, and then things start shaking loose and you can't clear your airway and your mouth's wired shut, blah, blah, blah. And I was like I felt panicky. Like anytime Peter had respiratory infections, that was always the worst for me, because he was always on oxygen too when he was little, and just when your kid can't breathe, it's so stressful. And, I would not let him sleep alone when we came home, and so he had the choice of sleeping in our bed. My husband and I, our bed elevates, so he had the choice of sleeping in that bed and either dad or mom. And I was like, pick one, but if it's me, I promise I will like be clear on the edge of the bed. He'd probably kill me for saying this, but he didn't want dad because dad snored too loud. so once he finally got over the respiratory infection, he talked me into letting him sleep in his own room, you know, because of course that's what he wanted most of all, be in his own bed. But I gave him a bell and I told him he had to carry that bell with him everywhere. And the first night I let him do it, he knocked that dang bell over. And I ran out of my bedroom and his brother ran out of his bedroom and we're like, are you okay? Are you okay? And Pete's like, I knocked it over. You know, he can't talk. He's like, calm down, calm down. I go back to bed and my husband's just snoring away. So, and you have this like give and take between the two, you know, the family dynamics. It's kind of funny to me because at the same time, my husband's put me on a plane during Peter's jaw recovery and said, you got to get out of here and get away. And when you come back, I'm going to have him drinking from a cup. I'm going to have him drinking instead of using the feeding tube. And he did. You know, I left because, you know, Darren was able to kind of push him when I wasn't able to, and vice versa. And when I came home, I go, well, this is fantastic. He's drinking from his cup, but you know, he's aspirating, right?
Details.
Like, he'll figure it out. Don't worry about it.
Details.
But that give and take of a mom and dad, male, female, two people, however dynamics are in your family, but it really does take a lot of support.
Dee Dee, that's such a great point. And Crystal, you said this earlier about your amazing husband, who please hug him for me, because, you know, it's not a product, it's not a service, but it's a necessity, is a plan and profound amount of love and preparation. No parent can do this alone. And it's just not possible. Now, some will say, but I'm a single mom, or this. You have someone in your life you love and trust. You need to bring them into this process well before the surgery. Hey, I'm going to need a couple of nights sleep here. I'm going to need to go away and have a massage. Like, that is as important to this process as the doctor you choose. Look, this will strain your marriage. It's not an if, it's when. You're going to hate each other. You're going to love each other. You're going to cry a lot together. As the women on this call all know, I'm a crier. So, and if anyone saw our 2020 special, it's all I did for an hour was cry. But I cannot emphasize that enough. Prior to the surgery, moms, dads, sleep. Like, if you're tired the day you walk into the operating room, you're hosed, right? Like, you got to, if you need vacation, and plan that as much as you plan anything else, right, Chelsea?
Absolutely.
I wanted to echo that if I can, and this is coming from the patient perspective. I look at my parents and I look at what they did all through my life as a child. They planned, they put me first, and they always put themselves second. And so when I developed an attitude and a voice, I definitely remember telling them, don't worry about me. Make time for yourselves. And so, you know, echoing everything you just said, like making sure that you have your laundry list of people that you can turn to prior to surgery, because there's going to be those moments where you're going to need to step away and you're going to need a break. Because we all know, you know, heading into that surgery day, just as you said, you know, parents can relate on this call of being the first parents in an OR waiting room and being there all day and seeing family after family come in, and then being the last ones to leave at the very end of the day. I think that's a common experience. Again, I'm not a parent yet, and I hope one day to be, but that is a common thread that I see with the parents that are on this call, and then my parents. So we know that. So you have to just, you know, look out for your child, but also do that self-preservation for yourselves too as parents.
Yeah, thank you. And I think I saw Nicole. Did you have something to add?
Yeah, I mean, I completely agree with what's been said so far. And I think one of the best things that families can do together to prepare for a surgery and the recovery and having those comforts of home is just to have conversations together about, what does comfort look like to you? Because for some children, games are more comforting than books, or having a special set of pajamas might be, comforting to one child and not as important to another. So having those open conversations about what support might look like post surgery, I think, is really valuable, and that also lets the child know ahead of time that that it's a family process, and that not only is the surgery important, but the life, afterwards is going to be important to the family too.
Thank you so much. And Nicole, while I have a question from our audience for you, so while I have you, I'd like you to just expand a little bit more on that, which was amazing. And we haven't even gotten into the family and sibling dynamics. But this question I wanted to ask you, being an adult. So their daughter, the person that wrote in, their daughter is not necessarily sure if this is a necessary surgery for her long-term quality of life. She was not treated when she was younger. She was in another country. So basically, what would you give as advice on, is it worth it to go back into surgery now? And what would you anticipate as an adult? Because recovery times are a little bit different for adults.
So this is an adult asking this question?
But this is a parent asking for, it seems like, an older child.
Okay,
Yeah.
gotcha. Oh man, I mean, it's so situational. I would say it really depends on what the surgery is and what the results will be. And I think it's important for parents and children to talk about, their values. What is it that we want to be getting out of these surgeries? Do we want to have a better quality of life in terms of one, health area, or is this something that, is there a certain aesthetic outcome that we're hoping for? I think having those types of really open conversations about the results that everybody wants is one way to answer those types of questions. So, and it also depends on what the patient's attitude is towards surgery. For some people, surgeries are really scary. And so that's something to consider. You might not want to have a surgery if it's really going to have an effect on your anxiety and well-being. But if surgery is more normal for you and something that's not a big deal, then I think it's much less of a big deal to go in for a surgery if you think that the result's going to be worth it.
Yes, thank you. You said that before in your answer, and I'm glad you said it again. Talking about the outcomes is so important, and letting that be child directed whenever possible. So thank you. Does anyone else, there's a very similar question that just came in, and they specifically mentioned Chelsea. Do you have any tips for managing that pre-surgery anxiety? And then we can go round robin, because this is definitely one of our questions. Pre-surgery anxiety management.
I think we all could say that we have our little, pre-surgery, like, pre-game checklists, and for me, when it's surgery prep, you go through your pre-op the days prior, you go through all of the rigmarole that we're all used to, being filled with so much information. I tell you, it's just so much. The do's, the don'ts, the risks, the positives, all of that. So we definitely get all of that in the days prior. And what we did, or what my parents and I did, from some of my later surgeries, when I was a teenager, we would definitely be intentional about unplugging and decompressing prior to the actual procedure. So not talking about it, having something scheduled, doing a really good family meal the night before, really spinning things that weren't centered on the big, scary monster that was going to meet us on the other side of the bed in the morning. So, we definitely did things like that. And we tried to, and it wasn't that we were avoiding it. We were meeting those conversations head on in the clinics and things like that. But we just were very intentional about, making that space and doing fun things before surgery. Literally, okay, so let me tell you this one quick story. Before, I don't know if this was necessarily fun. The day before I went in for my jaw reconstruction surgery, my father had me laying brick for a wall outside in our yard to build a lovely, like a planter box. Out in the heat, early summer, June. That was my fun thing to do before surgery. Surgery was the farthest thing from my mind that day. We were literally laying stone for that. I'm not recommending that you do that, but
He's
it's
brilliant.
It's just things like that. But that's literally what I did the day before surgery, was something that had nothing to do with it at all. And then also, like, the day of, remember to just breathe. I do a lot of breathing techniques when I get ready for surgery, because that really leads me focused. When I have surgery days as a patient, I don't talk to me. Don't talk to me. I've heard it all before. I'm good. Just let's get it done. I get very serious, and this is something that, you know, my parents were very used to. I developed that really early on. But I definitely use breathing techniques and things of that nature, because I know at the end of the day, once you're on the other side of it, it's all worth it at the end of the day. So those are just a couple things.
That's great. And Crystal, I think you had your hand up for pre-surgery anxiety management.
So sorry, it actually wasn't for that. It was the topic before that. I don't think maybe my video was on or something, so you maybe didn't see my hand was raised, but it was about Russell saying all the things that you need to do to take care of yourself. And then I believe it was Nicole who said, what does comfort look like to you? And, you know, Russell was talking about how I have the support of my husband, and, you know, sometimes he's not always around. I need support from my family because he's always working. And it became an issue with, what does comfort look like to you? Because everybody kept telling me, you need to go home and get some rest. Because I was living at the NICU. There's no eating or sleeping in the NICU. Yes, I wasn't taking care of myself, but it was more like, when is it ever an option to just leave your newborn baby somewhere and go home? Like, and everybody just kept fighting with me, like, you need to go home and rest. You need to go do this. You need to go do that. And it was just like, what I need is for you guys to stop telling me what I need and start being supportive of what I want, because I'm telling you right now, I'm not leaving him. So just get on board and stop fighting with me, because you're making it worse. So it's really just important to have people understand to be supportive in the way that you need to be supportive, and not in the way that they think you need to be supportive.
You're killing me, Crystal. I can't take it. I'm gonna need a drink.
It really bothers me that people are like, make sure that you take time for yourself. And I'm like, are you offering to babysit?
Where's my CCA wine glass?
Unless you're offering a solution, don't, like, just be prepared to offer a solution with your advice. Come over here and babysit, and I will gladly go take a nap. Otherwise, I really don't need you to tell me what I need to do without offering the solution, you know?
I'd be scared to get you and Magda in a room together. That would be just way too powerful.
Jono said the same thing. He's all, you guys are so much alike.
You and Magda, oh, it's scary. Like, me and your husband need to commiserate together or celebrate.
He cries a lot.
No, that is a good point. And I actually wanted to bring this up. So perfect segue. Magda, Russell's wife, has written a book and talking about the pre-surgery anxiety, the in the surgery anxiety. I definitely recommend the parents out there check out Magda's book. It's called Normal, A Boy and Her Beautiful Son. I believe A Mother and Her Beautiful Son. It's really a great look into their story. So I highly recommend you read that. It's a lot more than that, but that's one.
Made a plug, Eric. Good job. I didn't even ask for that. Full disclosure, no, that was not asked for.
It was not asked for, but
no, but
the conversation led to that for sure.
You know, there's this subject of the pre-surgery stuff, and Dee, I know you and I have had many a glasses of wine talking about this stuff. Nathaniel picked the routine. And it wasn't about, you know, to Chelsea's point, she wanted everyone to shut up and leave her alone. Nathaniel had this amazing habit of creating this fictional narrative about what was going to happen, right? So on the drive to the hospital, he invented these insane stories about why he was having surgery. Like, you know, this time, Dr. Hopper was like, the hospital was overrun by an army of monkeys and they all had muskets and they were going to shoot everybody with their muskets. And if he didn't have this surgery, he wouldn't be able to defend the hospital with his superhero friends. And like just letting him have that creative license to just tell the story, and believe me, a 7-hour car ride up to Cincinnati Children's Hospital, listening to stories about monkeys with muskets, you want to blow your brains out, but you got to let him. That's what he wanted. And, so, the funny anecdote on that one for us is Nathaniel had a habit of hugging and kissing mom like endlessly before we go in. But then for the operating room, I had to carry him in. Like there was no ifs, ands, or buts about it. I'm not walking. I'm not going in on a gurney. I'm not going in, asleep. Like they can put me to sleep when I get in there. I have a trach. It's easy to put me to bed. I figured this out early. Dad's carrying me in. So for his last surgery, at this point, he's 15 years old. He weighs 120 pounds. And he's like, let's go. I'm like, are you kidding me? He's like, oh no, pick me up. You work out. You're in good shape. You're carrying me down the hall. And so I did. And I told him now, you're going to be 19 next time. I ain't carrying you. He goes, we'll talk about it when the time comes. So I think that'll be funny. And other thing, parents, if you do go into the operating room with your kids, which can be very, very frightening, do not look at the instrument table. You do not need to see what's on that table for the operation. That's one piece of information you can learn to live without.
I highly agree with that as a patient. Don't look at it.
Don't look at it.
Yes. And while I have you, Russell, I do want to get to this and then we'll kind of do a little bit of a wrap up. Does Nathaniel have any trouble listening to music where the vibrations too much? Are the melody too noisy? He's a music guy or?
No. And it's interesting. Chelsea's a classically trained singer. As many of you know, my wife is from Eastern Europe and is a classically trained pianist, and went to the Juilliard of Poland, if you will. So one of my wife's most dire concerns when Nathaniel was born is, how will my son listen to me play piano and understand and appreciate classical music the way I do? Here's the good news. Nathaniel has 0 external ears. He has working inner ears. He has a bone anchored hearing aid. The technology today has gotten so incredible that he hears music and sound and TV at a level I could only dream of. Now, he hears it differently, right? He doesn't hear directionally. Everything comes from the center of his brain and resonates outward, but they're able to adjust the new Bahas in a way that can minimize background noise. They're just so amazingly technically advanced. Didi said it earlier. The Baha he has today, you couldn't even recognize it to the one he got when he was 3 months old, right? Like as far as technology. So no, he doesn't have any issues with hearing vibrations. If anything, there are times when things are too loud and he knows how to just tone it down. Last funny story, then I'll shut up. Nathaniel would be the greatest undercover detective in the history of Earth, because in the high school cafeteria, when the kid 2 tables down is talking about buying a dime bag from his buddy, Nathaniel's hearing it. And thankfully he comes home and it's like, Dad, a lot of people doing things they're not supposed to be doing in high school. And I'm like, how do you know? He's like, I hear everything.
Oh, there are many perks. So we talk about them a lot in our adults and alums call. There are many perks to being a craniofacial community member. So come to our adult meetings, adults, and we will share those. Didi, I want to ask you a quick question, and anyone else can jump in after Didi. Based on your experience, is a G-tube permanent? Taking in enough, and then we can have everybody kind of round robin that one if they need.
Is a G-tube permanent?
A permanent need to take in enough nutrients.
Well, I know there's plenty of people within the CCA community that don't have feeding tubes that have, endured these surgeries and navigated it without. But in Peter's case, he needed the feeding tube at birth. You know, we tried for a while, but it was pretty obvious he was not going to be able to suck, swallow, and breathe anytime soon. So he had the G tube put in before he even left the NICU. So he was discharged about 4 months after he was born with a trach and a feeding tube and all the accoutrements. And then, you know, it did make obviously the jaw surgeries and everything easier. Before he started kindergarten, I got him to the point where he would drink a liquid shake like an Ensure or Pediasure, whatever. Now he's old, so he drinks Ensure Boost. So like the senior shakes. But yeah, he's a rock star that drinks Boost. So funny. Because he still does not, he gets no pleasure from eating. I mean, he eats a little bit, but he doesn't eat solid food enough to sustain himself. He hasn't used the feeding tube much for years. But we kept through the years, we always kept it because he never had any like infections or complications from it. So there was, you know, it was easy to keep it. It wasn't, even though he didn't use it. I mean, we would use it like if he was sick, maybe to give him medicine or keep him hydrated. But, you know, by and large, he would consume his nutrition liquid. So then for the last jaw surgery he had, we kept it for that reason, knowing he was going to be wired shut. And then I wanted to have it. So his whole life, he went from having the trach stoma and the G-tube stoma at birth. 19 years later, I'm like, okay, this is what we worked for 19 years. We're getting these holes closed up. So the trach stoma and the G-tube stoma are gone, right? So the ENT, because he had to go for subsequent bronchoscopies after his airway surgery. So he had the trach stoma closed, and they said that they would close the G-tube in a subsequent surgery. Well, then that didn't happen. Didn't get coordinated. So he did have a final, that was kind of his last big surgery, was having the G-tube removed and all that. But for the airway surgery, they actually put a J-tube in, I think, because they didn't want any, that's a whole nother webinar, but the airway surgery, they didn't want any anything in his stomach that would jeopardize coming up in this healing of this area. So he had the J-tube in. It was good for him to have all that. You know, it was easy to switch to have it. So I'm glad he had it. It made it safer. You know, having the open trach stoma, we always wanted it closed, but it made it easier to secure his airway for surgeries while he was growing up. And that's why we waited till he was the final jaw surgery. There was no surgeon that wanted to suture the trach stoma closed, because knowing that he was going to need another big jaw surgery when he was older and would likely need to be retrached. So why close it and then have to retrach him? But as far as the feeding tube, yeah, I mean, it was definitely a perk to have it when he had his surgeries, but there's plenty of people that don't have one and manage it. Like Chelsea, did you have a feeding tube for your jaw surgeries?
No, I didn't have one for that round.
Because like you talked about the blender and everything. I mean, like I blend foods and can put it through the G-tube, but you know, you're going, yeah, so.
Awesome. Thank you. Well, I appreciate you guys giving us all this time. And I think we could go on for another hour, but I kind of want to get some closing thoughts out there so we can wrap up. I appreciate all of our audience members submitting questions. I'm sorry we couldn't get to everything. We're going to continue to do these series, and definitely please check out our Red webinar. A lot of these questions are also asked there, and a lot of them are crossover. So like the feeding solutions, comfort measures, those are all included in that webinar and that overview, which I know has been dropped in the Facebook chat. So just make sure you reference that. I have one little tip to add for pre-surgery management. This is more on the adult side. I am a big person that likes to treat my surgeries like exercise events. So I sort of train for them. So it helps me to manage that anxiety by knowing I'm doing something. So I will start with like hydrating 3 liters a day, 2 weeks out. I will eat a healthy diet that makes sense for optimal immunity and, you know, antioxidants. And so if you're an adult, and even if you're a parent, that is one way to focus that energy into something that's really productive. I go as far as to, I think it's like the night before, you're not allowed to have any liquid after like 3 or 4 a.m., I will set an alarm because I know I'm not sleeping anyway. And I will drink those 6 ounces of liquid at 3 a.m. So when I go in to get my IV, I'm like, I drank water, I'm hydrated, my veins are good. So that's just a little something I do. I just wanted to throw that out there for the people that are older, and it has really helped me to use that energy constructively. But with that, I definitely want to remind everyone also that if you do have an upcoming surgery, CCA has a care package and a support request. So you can go on the website, and if you want to talk to some of our panelists or people like our panelists who have volunteered, you can request that as a parent or a care package for your child. And that is just really great. We talked about that support network day of surgery, to have someone checking on you, calling you, texting you, that really gets it. They're not going to offer those platitudes like Crystal mentioned. They actually have some skin in the game. So with that, why don't we kind of do some closing thoughts, and I'll just call you out and put you on the spot if that's all right. Crystal, will you give us your closing thoughts? What would you like to leave with the parents and patients watching?
I think I would just like to say that, any surgery on a baby is always going to be difficult. You're hormonal because you just gave birth, and you may be dealing with other grief as well, maybe losing your career because, you're going to have to stay home now. Probably the one thing that helped me a lot was that my parents called in a grief counselor right away, because I wasn't doing well. I was kind of just staring at the wall in shock. And, I needed somebody to come in and just like help me process everything. And that really helped me out a lot. They do have, they're called like social workers, I think, at the hospital. They're not, I like my person better. And if you have your own person, that's great. The social workers are good, but they're more just like, well, that's how, you have a right to feel that, it's just not really, it wasn't as productive as the person that a legitimate grief counselor came in to see me, and my parents did that, and it really helped out a lot. So if you're having trouble, functioning or coping, I would suggest calling somebody in, privately to come in and help you.
Thank you. Awesome. Awesome. Chelsea, what would be your closing thoughts for our audience?
Living with a craniofacial difference is not a sprint, it's a marathon. And I think, as for me, as somebody who's received care and been on that receiving end directly, I've always had to keep that at the forefront, because we're just wishing for all of these moments to be over when it comes to surgery, right? But I have to remember, and we all have to remember, that there is light at the end of that tunnel. There is a positive for every negative, and these are all experiences that enhance our journeys. You know what I mean? Whether it's the patient view, whether it's the parent view. And I think that's something that I just keep at the forefront and encourage others to keep at the forefront when they're going through these moments, because again, these are moments and they don't define our lives, that kind of thing, whether it be from the parent view or the patient view. But yeah, jaw surgery, it can be scary, whatever form you're going with, whatever method you're going with, it can be scary. It's a big deal. As was said earlier, it's a lot of math. It's a big team. It's a lot of effort that goes into these procedures, and it's not something to take lightly. And it is definitely something that there should be anxiety about. I get it. So taking all of those things into consideration, and know that you have a team like CCA behind you, and people that are on this call that are sharing their experiences, because I'm just listening to these stories, and some of them are recent stories. I had my procedure almost 20 years ago, and just to hear some of the advancements that have been happening in the last 3, 5, 10 years, it's kind of amazing to see. kind of wish I had been born a little later, but you know what I mean. uh, but yeah, it's all shared experience. So there are resources out there, and you know, I have had this conversation with my mother many times, where she was also blindsided. She had no indication. I was born in the 80s, so medical technology was not anywhere it is today, and so I was a big surprise. And so, you know, just to see where all of that's come and the resources that are available, it's just kind of comforting and a beautiful thing to see, especially being on this call today. So those are just some of the things that I could offer up.
I appreciate that so much. Thank you, Chelsea. Nicole, what would you offer as a closing thought?
Okay, I think I'm unmuted. I'd love to echo what Crystal said. Chelsea too. I think what you said is beautiful and so true. And what Crystal was saying about being able to talk to people who can really walk you through something or really support you and see you for what you're going through and what your child is going through, I think is so vital. And like you mentioned earlier, I'm about to launch some mental and emotional health resources for patients and parents, and I'm really excited to do that because that's something that I really want to help out with and provide people with those resources so that there's not that sense of aloneness. And so that'd be my parting thought, is just be aware of the people that you're sharing your journey with and make sure that you're really getting the support that you deserve.
Awesome. Thank you so much. I am excited to see those resources as well. So I can't wait till you share. You have such a calming presence. So thank you for bringing that to our webinar tonight. Thank you, Nicole. Dee, what would you offer? And which one is that? I forget.
Abby, she's the only other girl in the house with me. So, you know, she's my Abby. Say hi. Yes, get a dog. They're like the best. They're the best stress relief you could find. Yes, Nicole, I have to say, you have the most calming voice. Your voice is just like reassuring. You have a great, you should do like radio or podcasts or something.
Meditation app.
Yeah, seriously. I guess, you know, for talking about the mental health and all that, and you know, I'm not one to ask for help. My husband got me help when I needed it, when Peter was a baby. And you're not, you know, when you're going through whatever you're going through as a parent, a craniofacial parent, you're not immune to other things happening in your life. I know Russell can relate to that very well. You know, other things happen, and sometimes it's too much, and you need to talk to someone to help get through that grief process. And I had a lot of that when Peter was little. But the thing that helped, the jaw surgery when he had when he was 16, you know, we'd been going to the retreats, the CCA retreats for several years, and they had become our annual, like, you know, I really miss it. With virtual just isn't the same. I think we can all agree, as being in person and giving each other hugs and stuff. But Peter had the jaw surgery in June, right after school got out. And so the retreat was at the end of June. And so we weren't sure if we were going to be able to make it. It was one we could actually drive to, though. And we actually went to his surgeon in Michigan. We drove from Illinois to Michigan. He got his wires cut, so his jaw was released. But of course, he was like the Tin Man, you know, that needed oil and couldn't figure out how to. I mean, after jaw surgery, you have to relearn how to swallow. You have to relearn how to talk. You have to, I mean, it's a brutal recovery. And that's another advice. I don't think I focused much on the recovery. I was so focused on the surgery itself and getting through that. And then it's like, none of us, I don't think, anticipated how long the recovery is. And like Chelsea said, it's a marathon. But for me, we went from his doctor getting his wires clipped, did an overnight stop at my in-laws in Ohio, and drove to the retreat, which was in Reston that year. And I cannot tell you how overjoyed I was to see my friends from CCA, and Peter, he needed to see his friends from CCA, and Jacob, his brother, the siblings, my husband, Darren. You know, we needed to be with our tribe of people because they all got it. You didn't have to explain anything. You know, everyone knew. I had been texting me and messaging us about Peter and how he was doing, but it was such a relief that we were able to make the retreat that year, because it gave us that boost we needed to get through the rest of the summer. because it really was a marathon recovery. So you need a lot of support to get through all this kind of stuff. And I'm not the best at asking for help. I don't think most of us are. So CCA is just a godsend when it comes to that. For us, it has been. So.
Thank you. Thank you so much. And it has been for probably a lot of us on this call. So thank you for saying that.
Yeah.
Awesome. Well, let's finish with Russell. And I think we have an additional guest who will drop in and say hello to give us some closing thoughts.
Guest of honor, just brought Nathaniel in real quick. He can't hear you because I'm in my headset, but just say hello to everybody. Hello. And the closing thought I want to leave you guys with is pretty simple. Like, you will get here. You will get one of these. And all right, take off. You can go now. So, there's a very old Yiddish Hebrew expression, and it's man plans and God laughs. And basically what it means is you're going to make all the plans in the world about when to do surgery, who to do it with, how to do it, where. You are going to map it out. You're going to plan for every detail. It's going to get screwed up. And you cannot control that. But what you can control are the choices you make as a parent and as a sibling. You can choose to love your child unconditionally. You can choose to love your spouse with all your power and be there and support each other. You can choose to find the best doctors. You can choose to use CCA as a resource. You can choose to call me or Dee or Crystal, because I know for a fact every one of us will take your call and be there for you as a part of our community. So I have this expression I tell my kids: don't make a plan, make a choice. And then don't question your choices. You're not making a mistake. God's just messing with your plan, but your choices are always going to be spot on. So there you go.
Awesome. Thank you. Thank you. That is absolutely needed for reassurance, and I appreciate that. And I want to just highlight, as we are closing out, you can request 3 of these families, the Newmans, the Dankelsons, and the Crystal and PJ, to talk to your school. They are professionals at that. I'm pretty sure that Chelsea and Nicole do that as well. We've called on them multiple times. Pete and Dee, they have this amazing resource called Pete's Diary. He's also a rock star, as we mentioned. We're not just saying that, he literally plays rock and roll music. So get some inspiration by seeing where all of these talented adults have been. I mean, that makes a lot of difference to the people writing in about your older children needing encouragement. Look to the adults in our community, please. For the younger kids and the families, make sure that you are blanketing them in an atmosphere of acceptance in their school. And you can do that by requesting these speakers and others from CCA. And please, if you have a question, the only reason we do these webinars is because you guys say, I have this coming up and I want to hear from some people that know what they're talking about. So please continue to make requests of us. We love doing this, and we absolutely appreciate everyone on this call. So Chelsea, Dee, Nicole, Crystal, Russell, thank you from the bottom of my heart for giving us your time. And thank you to our audience for listening in and making those choices for your family. You are leading the way and setting the tone and example for them. And they are so blessed to have you in their lives. So good night, everyone. Thank you. The recording will be available on YouTube in a couple of weeks. Just wait for us to get it edited and uploaded. Have a wonderful night.
Bye.
Bye.